Hello, hello, hello. This is Truth Be Told. This is Dr. Walter Ackah.
Hey, my name is Dr. Leroy Horton, and my eyes are hurting because it's so bright. It's so bright. Walt's teeth, he got them whitened, and I can't see.
This is why I didn't want to tell you anything.
I need
This
my
is what this is
sunglasses.
this
What's
is
going
why
on?
this is why I didn't want to tell you anything. So we got to explain everything, right? Because
Okay,
it makes me sound crazy.
tell the
But
story.
we have to tell the story. So
Okay.
so I think you and I were talking a few days ago, right? We were
Mhm.
talking about whitening, and we're gonna, we're gonna talk about like some clinics that have opened just to treat whitening and what we think about that. What just to
Oh,
basically
yeah.
whiten, patients' teeth and so forth. So you got me thinking. You said, I said to myself, I said, Walter, have you ever had your teeth whitened? And I said,
Mhm.
no, I've never had my teeth whitened. Because I don't drink coffee. I barely drink tea, and I
Yeah.
don't really drink red wine because I can't tell the difference between a good red wine and a $2 Chuck. You know what I mean?
Right,
So I'm
right,
not
right,
bougie enough to like know the difference. So I really just don't drink it. You know what
right.
I mean? And so like I just brush my teeth. I brush my teeth and
And you don't smoke.
I don't smoke. I don't do
Yeah.
that, right? And so these are factors that I never had, and I got darker skin, so I've never
Mhm.
had any reason to whiten my teeth. Never.
Right.
Okay, so um this week, that's what happens when I have some free time. Normally I'm busy doing stuff, but I had some free time and I contacted a friend of mine. I said, "Hey, can I come to your office to get my teeth whitened?" And her response was, "What the heck are you talking about? Your teeth are already white." And I was like, "No, no, just hear me out, right? I want to know how it feels to go through the Zoom whitening." And she
Right.
goes, "You're crazy, but okay. Come to the office.
Okay.
We have some time. Let's go ahead and do it." And I said, "Okay, cool." So I go to the office, and the first thing that I get there, and the office knows me and stuff. So the front goes, "Oh, here's some Advil," and I was like, "What are you talking about?" They're like, "Oh, you're gonna need it," and I was like, "What?"
Oh,
So
snap.
then I'm thinking to myself, like, maybe I shouldn't do this. For real,
Right.
like she literally gave me like two tabs of Advil, and I was just like, she goes, "It's gonna be sensitive, it's gonna hurt, so you might want this," and I was just
That
like,
bad? I
right,
mean,
this is
I
this
might I
is
might do that if someone's coming in for a surgery. I might say, "Hey, we're doing a pretty big surgery. Let's get some
right.
Advil on board." They did that for whitening?
They did it for whitening, and I was like, okay. And then I actually started getting a little anxious because I was like, oh man, this may not be worth it for the podcast. This is not it. This is not it. I can't. I might not do this, right? So
Right.
yeah. So then I get to the back, and the hygienist was the one that see me.
Okay.
And she's like, "Oh, have you had your teeth cleaned recently?" I said, "Yeah, actually, I have. I had my teeth cleaned like a week and a half, 2 weeks ago." And I said, "Yeah, it was great." Oh, by the way, I'm not a hypocrite. I actually don't have perio disease. So the stuff I tell my patients, guess what? I'm doing it, right? And that was something that the hygienist was so funny. She was like, "Oh, your gingiva, your gums are really good." I was like, "So I'm not a hypocrite. That's
Not a
good. I
hypocrite.
want you to tell my patients that I actually follow my own advice." But anyway, so I sit down, and here's the funny thing. They basically go ahead and they give you they have you sit down, and
Mhm.
then they go, "Okay, here you go." And then the one thing that the hygienist said the same thing. She goes, "Oh, have you had your teeth whitened?" And I'm sorry, have you had your Advil? And I was like, "What are you talking about? Why is everybody asking me if I want Advil or if I've taken my?" And she goes, "No, I would recommend you taking your Advil." And I was like, "What
I
is
am
going
scared at
on?"
this point for you.
Right. And so then my question goes like, I started thinking to myself, like, is this something that's just normal? Or is
Right.
this just something that like, are they just trying to be funny? I think that they were trying to be funny, but they were also serious because then I talked to my friend and I said, "Hey, do you tell everybody to get Advil?" She's like, "Yeah, the area we are, like, people are really bougie here and they don't like anything that involves a little bit of pain or anything like that." And I was like, "I've never
Really?
heard." Yeah. So I want to ask you, like, whenever you were doing whitening, did you give
Right.
people Advil?
There's never a thought. I mean, some people might get some sensitivity. So typically with the Zoom whitening, we used to do the official Zoom whitening, and then there was another brand that we went with. You do
Okay.
it in rounds, right? Did you
Okay.
have multiple rounds that you could opt to do?
Yeah, so they told me that I needed to do 4 rounds,
Oh,
15 minutes each.
right.
Right. And so I basically was going to be there for, they said 2 hours.
Jesus.
Yeah. Listen, this whole thing made me really reconsider. Like at first I was like, this is for the podcast. Like I want to do this to feel what it feels like so I can talk about this.
You're the
So we can
sacrificial lamb.
yes. And I
You martyred yourself.
bro, the second I get there, I immediately regretted. The second they said you want Advil, I started really reconsidering everything. I was actually gonna turn around and go home.
Right.
You know what I mean? But I was like, okay, no, like let's continue this. And the further back I got to the room, sat down, the more I really was like, nah, this might not be it. I might need to go ahead and say I did, right? Lie about it. And I started, because you start processing. And I was like, maybe if I lie about it and or ask patients like how they went through it, then you guys might believe me.
Right.
You know what I mean? But they were like, no, you got to do it. And then of course, like the assistants and everybody, they're younger. So they're like, oh, you can put it on Instagram and stuff like that. And I was like, well, start off with, I'm not doing that because it's gonna, if I start crying or doing, and you know what I mean? Because of the pain, I start crying, I'm going to look worse than I really want to look. You know what I mean?
Now, mind you, for anyone listening, Walt's not talking about jumping out of a plane.
No, this is just
he's just talking about going to get some tooth whitening because this is getting serious.
I'll be the first one to tell you that I'm a wuss when it comes to dental. Like everybody knows not to deal with me because like I don't like shots. I remember when I had to get my implants and stuff, I hated every second of it. I was so anxious. I'm the biggest hypocrite when it comes to shots because I give shots every day, all day.
Mm-hmm.
Then ask me to get a shot? Nah, man, you might as well forget it. I don't like giving blood. I still do it. I don't like it.
Right.
Every time I have to go like, yearly, like I'm like, oh, okay, I'm going to go ahead and get my, blood work done or whatever. I hate it. I tell the phlebotomist, like, look, I don't want to see what you're doing. I don't care to see what you're doing. This has nothing to do with me. Just hurry up. And they always laugh. They're always like, oh my God, what do you do? And I was like, oh, I'm a dentist. And they're like, what? And I was like, yep, I hate it. I hate every second of this whole entire process. So yeah, man. But I want you to break it down for me. Like, what are some of the people and what are some of the reasons why somebody would not be candidate for whitening? Because everybody wants to get their teeth whitened, right? Because we got that whole Instagram culture.
They do. Typically, my patients it was either younger patients who were just very into aesthetics in general, right? So it was the same patients that were doing the Botox and the fillers, and they would, come in 3 times a year for whitening, right? Then you would kind of get your older patients who were just trying to revamp their life, whether it's post-divorce or whatever. And, a good candidate, obviously, is someone like yourself, doesn't smoke, doesn't drink anything with a lot of pigments that would stain. Mm-hmm. Someone that doesn't naturally have very yellow teeth to begin with, because then expectations are low, right?
Well, okay. So I guess we should also explain what happens as we age, right? So when you're kids, and I want you guys to anybody that's listening, go and look at your kid. If you have a younger kid, from newborn all the way to like 10, 11, if you look at their teeth, naturally they're white. Why? Mm-hmm. Because when we develop our teeth, we have thicker enamel, which is the white stuff that you see, and thinner dentin, right? But as we age, we actually lay down more dentin. So the yellow stuff is what we're actually laying down. And then the enamel, the one on the outside, is actually what gets resorbed away as we get older. That's why as we get older, our teeth get more and more yellow. I mean, tell me if I'm wrong at any time here.
No, absolutely. And I think patients, a lot of times when you explain that to them, that the dentin that's underneath is naturally yellow.
Yep.
Like, because it's yellow, that doesn't mean there's anything wrong with it. Right. And if your enamel is really thin, or it just happens to be very translucent, that yellow is going to show through. And power whitening, bleaching really isn't going to change that. In those cases, you need something like veneers to cover up that yellow that's shining through. But for some people that have an adequate amount of enamel, or the white structure that's on top, but it's stained, with years of coffee, tannins from tea, pigments from different foods and stuff, or just from smoking, then, using bleaching agents can dissolve a lot of that stain. And then at the same time, it also dehydrates your enamel. And when it dehydrates the enamel, the light reflects off it different. So it gives it a much more chalky white appearance, which immediately after your whitening, it tends to be super white. But then after a few days, when that enamel rehydrates, it tones down a little bit.
Right.
The stains are still gone, but it's not as chalky white in appearance because now it's rehydrated.
Right. And I want you to break it down when it comes to, so after you get your teeth whitened, what are
Mhm.
the do's and don'ts?
Well,
I can tell
definitely
you what they told me, but I feel like you'd be
right.
better off to kind of break it down for us.
Well, we'd give them a either a whitening or a peroxide toothpaste to use, usually with some sensitivity agent, like potassium nitrate, like you would find in Sensodyne. And that helps with that sensitivity that can happen because you're dehydrating your teeth. It can cause sensitivity.
Right.
And we tell them stay away from coffee, tea, highly pigmented foods, or red wines, Kool-Aid, any of that kind of stuff. And obviously, if they're smoking, we're always telling everybody don't smoke, regardless whether they're whitening or not. Right? You walk into my
Did they
office,
ever listen?
you know, when they listen, when you hold whatever procedure they want hostage.
Oh,
They want an implant, a sinus lift,
right.
but they tell you they smoke 2 packs a day. There's a lot of times where, if someone's a mild to moderate smoker,
Right.
we might make a concession of, hey, you need to, go on a patch or something for a couple weeks before and after surgery. Then you can pick back up your habit if you have to pick it back up.
Right.
But if you're an extremely heavy smoker, I'll just tell them, I'm not going to do it.
Oh,
Unless you can prove to me that, you haven't been smoking for X amount of time. And I've had, not a high success rate in converting those patients, but I have, maybe of those patients, 10 to 20% that will say, okay, I really need to revamp my oral health. And if I got to stop smoking, maybe this is the motivation that I need. And usually when I was younger and I first graduated, I would prescribe something like a Wellbutrin or now we have Chantrix.
yeah, to help them stop smoking.
But now, those are medicines that help curb the cravings and help patients stop smoking. Smoking is it's harder than crack to kick. A lot of the studies show that
I've
your
never
average,
heard that, but
yeah, your average number of attempts is like 7 before someone is actually successful at quitting because it's so physically. Well, the thing is, it's physically addictive.
right.
Nicotine is, but it also has antidepressant qualities or affects.
Okay.
And so what happens is that's why someone, when they're really stressed out, they're like, oh, I need a cigarette.
Right.
Oh, I'm sad, I need a cigarette.
Okay.
And so there's a psychological component.
Right.
And when you don't have anything to substitute, and that's why something like a Wellbutrin works, right? Because it helps curb the cravings, but it's also an antidepressant. And so it helps you cope with life as you're quitting this addiction.
Got
right?
you. Okay. Well, see, there you go. Right.
Yeah.
Man, we're just spitting out gems right now. But I want to do something. I want to
Okay.
show you, okay, just to prove that I actually went through this.
Oh,
You know what I mean? Like, I
evidence.
want to show you to basically prove that I actually went through this. So I'm gonna share my screen because no, people think I'm crazy, and I know I am. I know I am, right? Because even my wife was like, "What are you doing?"
Right.
Because she got the email from the other office saying, "Hey, you got no dental appointment." She's like, "What are you talking about? I just saw you 2 weeks ago."
Wait, I forgot your wife's your dentist?
Yes. That
it took a lot of her?
It took a lot of convincing. No, I came up with this idea like literally that day.
Bro, that's like cheating. That's almost like cheating.
Well, yes and no. Yes and no. This was for the podcast. So it's for you guys. Okay. It's for you. If my marriage ends because of you guys. Okay. But I want to show you exactly what can you see? You can see this, right?
Yes.
This is me sitting and basically going through the process. So right now, as you can see,
they got the protective glasses.
Got the protective glasses, and she's putting that white. That's basically to protect my gums from the acid, and that's another thing that made me nervous. I'm like, man, she's putting a lot, right? And I can see this, but that is really helpful to protect you from the acid that's going to be on your teeth directly.
Right.
So as you can see, I'm literally sitting here, and she's going at it. She's putting a lot of protective stuff on my gingiva, right? And oh, by the way, that mouth thing that keeps your mouth open and everything, very uncomfortable. Very uncomfortable, especially when the Zoom sits on there. Oh my God, man. You might as well just call it a day. It is very uncomfortable. So
wait, who's holding the camera? Is that you?
That's me. I'm doing a pretty good job, right?
It's very steady.
Thank you. Yeah. I'm basically trying my best to keep my hands steady, as well as also try to get dental work done, but I wanted
Right.
everybody to see that this was legitimately me going through this process.
Okay.
You know what I mean? So we're basically, yeah, see, there it is. I'm like, I want everybody to see, and then she keeps coming back. And I'm like, man, how many times is she going to come back? You know what I mean? But the one thing is, like, she did an excellent job, because you really do get that. It starts to get warm. So thank God that she's protecting and making sure that I got my gingiva completely protected. So that's something you got to be aware of, right? They're
Yes.
going to put that on there, and they're trying to make sure that they protect your gums, right? And then after that, they put the light on there. Oh, the cure, that curing light just makes that little white thing harder, so that it stays in place.
Right.
And then they'll put the acid on there, and then basically just go to town. 15 minutes, 15 minutes, 15 minutes, 15 minutes. So 4 sessions of 15 minutes each. Okay. And then when it beeps, like, you're sitting in the room, you just I'm just playing I think I was playing my slow jams. You know how I do. And then basically whenever it beeps like really loud, like 3 times, and people just run into the room like as if something was on fire. So I'm not sure if it was because they knew me, or if this how like responsive they are to the to the alarm of the Zoom. And this is a Zoom whitening. So again, I think I'm getting to the end here. Let me see. So she's just checking and making sure that everything is good to go. So that's what I look like before.
That is the sexiest thing I've seen all day.
I doubt that.
With the slow jams in the background too.
Exactly. So yeah, man, that was basically it, man. You know what I mean? It made me laugh. It's I want to basically show everybody that I absolutely went through that.
So you were there.
Yeah, I was there, and I did it. What I'm gonna tell people is, if you don't need it, don't get it.
Right.
Right. Because they have these things at the end when you're done. It's called zingers. And it basically just happens where all of a sudden you feel this sharp pain that just goes through a tooth. And it happened to me on my one tooth right here. It just randomly for about maybe 2-3 hours. It was just random, like zing. And I'm like, oh, there it is. That's what they were talking about, right? And so that's one thing. But in all honesty, if you really want to do it, if you have to do it, it's not too bad. It's the fastest way you can get the result you're looking for. And like you said, if you have yellow teeth and then all of a sudden you get this whitening, it will change. It will make your teeth way whiter. Does that make sense? It will do that, and it will make it look really good. So I highly recommend doing it if you're just like, listen, I have a wedding to go to, or I am the bride, the groom. You know what I mean? It absolutely, it absolutely would do it, man.
But like most things, cosmetic is not permanent, right? So with Botox, you got to get the Botox retreated every 3 to 4 months. Same thing with the whitening. The effects tend to fade after the first couple months. Right. So most people that do it regularly do it at least 2 to 3 times a year minimum.
Right. And don't forget too, like if you drink coffee, if you drink wine, red wine, if you anything is going to stain your teeth, you might have to go earlier you have to go probably sooner, right? If you really want your teeth to be super white, right? If you get veneers, a lot of people think once I get veneers, veneers stain.
Yeah.
Veneers stain. So if you want something more permanent, which would be like I cut my teeth down, or I don't even cut my teeth down, but I get veneers on there, veneers will also stain. The only problem is, guys, I want you to remember this. You cannot whiten veneers. You cannot whiten crowns. Right. That is something that they will tell you. You cannot whiten crowns. So whatever color that crown is, that's the color you're going to leave with.
Yes.
Okay. So that's something that I actually was like, I need to make sure I tell people this, right?
Yeah.
Overall, the experience was not too bad.
Okay.
It was not too bad. Was it scary at first? Yes, especially that Advil thing. I would recommend don't give your patients the Advil and say, "Oh, it's really gonna suck," because that's really what I kept hearing. Oh, it's gonna suck, Right. I mean? So that's the first thing. Right. The process itself. I mean, the hygienist that worked on me did an incredible job. Beautiful, beautiful job. Is it expensive? Yes and no, right? Sometimes insurance may cover it. There are companies, and there's a dental chain around here in Houston that will give you free whitening and what was it, x-rays if you have a PPO, but you never hear the PPO part in the commercial. You just hear free whitening and x-rays. But the PPO is because they're charging your insurance for any difference. They don't charge you, but they charge your insurance for any
free
difference.
For you.
It's free for you, but not for your insurance. So they'll always tell you that if you don't have insurance, I can guarantee you they're not going to give you whitening for free because they're losing money on it. Right. So I want you guys to remember that anything free, it may be free for you, but it will not be for your insurance or anybody else. Okay.
Or you're paying it on the back end.
Or you're paying on the back end. That's exactly right.
Yeah.
A lot of people are just getting you in the door because they'll find other stuff to charge you for.
Right.
So you know, we try to our best to give you guys the insight. We try our best to let you know what dentistry looks like, and I put my body on the line. You know what I mean?
Oh,
I don't want to call myself. I don't want to call myself a hero, but somebody's got to do it. And if you want to call me a hero, I mean, come on.
I'm gonna send you a Purple Heart in the mail because
I don't want to go that far. Those are actual heroes. I'm just a dental hero. You know, I put my body on the line for our listeners because I care. You know,
right.
I believe that children are our future. You know, and teach them well. I just want to teach them well and let them just lead the way, brother. You know, show them all the beauty. Come on now, inside.
Yes.
You know,
you got to end it with a
right. What was on Coming to America? Right. Oh man. Yeah. Anyway, if listen, I'm going to say this right now. If you consider myself a friend, if you consider me a friend, you will go see Coming to America before I ask you, because I've been known to end friendships because people have not seen Coming to America.
Really?
It's that serious to me.
Wait, here's a question, because the first one was a classic.
Absolutely.
One, hands down, one of the funniest to this day.
Absolutely.
I was not impressed with the second one.
Oh, the second one was garbage.
It was trash. The second one was
garbage. It was basically a money grab.
Yeah.
Amazon basically said, we'll give you a lot of money for you to do something garbage. And you almost ruined the legacy of the first one.
Absolutely.
You know what I mean? I watched the second one. I couldn't finish it. I said, this is trash.
It was trash.
This is trash. So I don't care if Amazon never sponsors us. What you did was horrible. I hate you, Amazon. I love you because you make my life easier. And I swear to God, we probably kept your business alive, but I hate you for Coming to America too. I absolutely do. But anyway, let's end it there. But I wanted to let everybody know that getting your teeth whitened, the sensitivity part, I never got it, but I didn't go through all 4 stages. I think the 4th stage might have been a little more sensitive. I know that Zoom has changed the light that they use.
Mm-hmm.
You know, so it doesn't cause as much sensitivity as it used to cause, from what I was told.
Okay.
They said a few years ago that you'd be more sensitive, no doubt.
Right.
You'd be more sensitive now. Like honestly, I didn't feel any sensitive. It could have been the Advil, who knows? But
maybe, yeah.
But I didn't feel that sensitivity. But I also didn't go through all 4 stages. Okay.
Right.
If I would recommend anything, I would say get the trays so that you can just keep up with it, like touch-ups as needed, right? Instead of having to go back to do a whole Zoom or whitening, course again, right? For an hour and a half, 2 hours. Just get the tray. You can put a little bit of that whitening material in there and then put it on. It's like Invisalign. Just put the clear liner in there, clear tray in there, and then just let your teeth. I think it's like 30 minutes. Right.
Did they give you that? Because I remember we used to do the whole session, and then we would make custom trays for them to take home, and then they get the little gel syringes.
That's it.
So they can do touch-ups periodically.
When do you tell them to do touch-ups? Is it weekly? Is it every 2 weeks? Or
it's been a while. I want to say it was weekly.
Yeah.
For 30 minutes.
Right. Yeah. And it's not bad. You can do that while you're watching TV and stuff like that. I don't think The Office took me too seriously. That's why they didn't give me what they would normally to everybody else. You know what I mean? But definitely get the trays, definitely get all the stuff that you need to do it. But overall, the experiment on myself was it too bad? Not really. Is it one of those things where I always tell everybody preventative, right? If you don't smoke, don't drink coffee, don't red wine, and if you do all that and you brush your teeth, you might actually not cause that yellowing effect earlier on. So that's another way to save money. $2 toothpaste versus $400 or $500 whitening. Right.
Yeah.
Let's think about it. So again, these are the kind of things. If you want to drink coffee, by all means. I know a lot of people that if they don't have their coffee, they could kill you. I don't want that. I don't want people to die because of coffee. But just make sure you brush your teeth. Your teeth. You can get that. The one thing people always ask us too is like, oh, what kind of whitening toothpaste do you really trust? I don't care. they're all, to me, they're all very superficial. All it's doing is just getting rid of everything superficial, right?
Right.
Not deep stains, but more like superficial stains. So again, those are the ones that I don't care if they call it Jubilee Doo and Yakety Yak toothpaste. Don't care. I'm not going to sponsor anyone. I'm not going to sponsor anybody. It does not matter to me. Just go get it and use it. That's it. You know what I mean?
I'm with you.
Yeah, unless somebody does pay us, then of course I'm going to sell out and sponsor them.
Of course.
But thank you as always, my man. We
Yes,
really
sir.
appreciate you, man. This was awesome. Let's go ahead and we're just trying to share the love, man. We're trying to share the wisdom. So we're gonna say good night here.
All righty.
You want to say some Spanish to make people feel like you're better than me? By all means, go ahead.
All right, I'll say it in Greek. Because that is my first language.
Nope, we're gonna stop. Nope. No, you're doing too much. Because now you're doing Greek, and then everyone's gonna be like, they're gonna come at me talking about I know nothing compared to you.
No, you said Fonte, right?
Yes, that's true. But again, it's like one of those things. If I say it, I'm gonna look some kind of way because I'm like, oh, he said Spanish, now I gotta speak fine. It's just gonna look bad. First the hair, you got the hair with the ponytail, and now you're doing this. You're doing too much. You're doing too much. I'm gonna just cut.
Well, how about this? We'll teach everybody in you. So we know that obviously in Spanish is buenas noches for good night. Mm-hmm. In Greek is kalinichta.
Okay.
So it's Kali, Kali. Okay. And then nichta is Ni, a hard HTA. So kalinichta.
Okay. All right. Well, there you go. All right, man. We'll talk soon then. All right.
All right, brother.